Hello, everyone. I'm Dr. Sumbal Ijaz, your MRCG1 mentor here with Instutors. Today's live session is all about microbiology, and at the end of this session, I'm also going to discuss some of the challenging topics from the endocrinology. I hope everyone is doing well. Give me a second. I'm going to share my screen for the presentation of the slides. Okay, so today we are going to start our module 5, which is microbiology. Let's dive in. Microbiology plays a significant role in RCOG curriculum for several reasons, such as microbiology forms a foundation for understanding infectious diseases, microbial therapy, and infection prevention strategies in obs and gynae. While studying microbiology, you should be focused on infections in obs and gynae, such as STI, pregnancy, and microbiome, prevention of vertical transmission of infectious agents from mother to the fetus during pregnancy and during childbirth, and also the infectious control strategies in the obs and gynae during the pre-op and the post-op surgical procedures. So here I made a list of the high-yield topics from the microbiology. As you can see, the high-yield topics from micro in RCOG curriculum are the torch infections, structure and classification of bacteria, structure and classification of virus, sexually transmitted infections such as chlamydia, gonorrhea, syphilis, and HIV, management of bacterial vaginosis, candidiasis, and pelvic inflammatory disease, screening and treatment protocols for group B streptococcus in pregnancy, rubella, and chickenpox. These are the high-yield topics in RCOG curriculum. In the exam, you're most likely getting questions from these topics regarding screening and treatment protocols. Recognition and management of infections in obstetric emergencies such as chorioamnitis. Immunization recommendations for pregnant women, including the flu vaccine and Tdap vaccine. Along with this, you will also get some questions from the rubella and chickenpox management or vaccination recommendation during the pregnancy. Sepsis or puerperium sepsis. You should know about the guidelines of the treatment of sepsis. Vaginal discharge and its different causative organisms. Emerging infectious diseases and their implications for obs and gynae care, such as Zika virus or COVID-19 during pregnancy. So these are some of the high-yield topics from the microbiology, and in all of these topics, among all of these topics, the most important topic is the vaginitis. There are a lot of SPAs in the past calls which are from this topic. So that's why I decided to take a deep dive in this topic so that you should know how to start and how to extract information and how to tackle different kind of SBAs from this topic. So here's the overview of the vaginal infections. The causative organisms of vaginal infection, mostly 84.9% are due to bacteria, which may be E. coli, Klebsiella, Staphylococcus aureus, Streptococcus, Gardnerella vaginalis, and Proteus. In this exam, you're most likely to have questions from the E. coli and Gardnerella vaginalis in terms of bacteria. Fungi is 11.3%. There is no need to remember the percentages. This is just for your better understanding. So the organism which is mostly causes vaginitis is Candida albicans. The next is protozoa, which is 3.9%. And the most common organism causing vaginitis is Treponema vaginalis. So vaginitis may be infectious or it could be non-infectious. Infectious vaginitis is due to bacterial vaginosis, vulvovaginal candidiasis, and trichomoniasis. So these three causative organisms are very, very important in the exam, and you will see most of the SBS from these three topics in the microbiology section. When we go into non-infectious vaginitis, the causes are atrophic vaginitis. We have the SBU from this topic, allergic vaginitis, foreign body, chemical irritation, desquamative vaginitis, and lichen planus. So this is important to remember both the infectious and non-infectious causes of the vaginitis. Here's another table for the better differentiation of three types of bacterial vaginitis, bacterial, fungal, and protozoal vaginosis. In bacterial vaginosis, there is overgrowth of bacteria naturally found in the vagina. Its odor is fishy or unpleasant. The color, the color of the discharge could be thin, milky, white, or gray in color. Itching or burning irritation sometimes present or sometimes not. In mild cases, there is no irritation. And there is a difference in the pH. Sometimes in the exam, they give you this table and they mention about different causative organisms and the color of the discharge, and you have to pick the right option. When we see in the yeast infection, and we already studied that the most common causative agent in yeast infection is Candida albicans. There is overgrowth of fungus in vagina and or vaginal opening. There is no odor. This is the classical finding of yeast infection. If there is no odor, you can rule out the yeast infection in the SPA. The color of the discharge, it is thick, white, cottage cheese-like. Sometimes itching or burning may be present or sometimes not. There is no difference in the pH. You have to remember all of these key points because they manipulate this information and made many SBs out of this information. So this table is very important. When we go into protozoal infection, which is trichomoniasis, it is sexually transmitted infection in vagina caused by parasite. It also have unpleasant odor. The color of the discharge is frothy, yellowish, or greenish in color. Sometimes itching or burning present, or sometimes it is absent, and there is increased pH. So we can see it is very easy to rule out Candida albicans because it has classical findings. There is no change in the pH, and there is no odor, and the discharge color is white in color or cheese-like. Am I clear so far? If you have any question, you can drop in the chat box and I will answer all of your queries at the end of this session. Okay, so someone asked me, they asked some questions that they are finding some challenging in the endocrinology topics. So I tried my best to concise this topic, which is Cushing disease and Cushing syndrome. Okay, so many candidates confuse this thing, like what is Cushing disease and what is Cushing syndrome, how we can differentiate both of the diseases or both of the findings. So as I always advise my students, whenever they are studying endocrinology, please start from the hypothalamic pituitary axis for the better understanding of hormonal regulation. So for as far as Cushing disease is related. Basically, it's a condition in which there is high level of cortisol in the blood, and the clinical manifestation of this disease is due to increased level of cortisol in the blood. So where does this cortisol come from in the body? It all started from the hypothalamus. As you can see in the diagram, hypothalamus releases a hormone, which is which is CRH, corticotropin releasing hormone, which acts on the anterior pituitary and causes the release of ACTH, adrenocorticotropic hormone. This hormone then enters into the blood and travels down to the adrenal cortex. We have an SBA here. Where do this ACTH acts on the adrenal cortex? Which zone of the adrenal cortex this ACTH acts on and releases cortisol hormone? So we should know about that zone of the adrenal cortex. When this cortisol is produced, okay, so cortisol is basically a stress hormone which produces as a result of physical stress, emotional stress, and the condition of hypoglycemia, cold exposure, or pain. So basically, it's a stress hormone. Since it's a stress hormone, what could be its function? So whenever you are going to study any pathology, you should be know about the normal functions of any hormone or any body part you're going to study about. So, what are the normal functions of cortisol? If we know that, then we are in a better position to distinguish between the abnormalities. Here, I mentioned the functions of cortisol. Uh, it's a stress regulator hormone. Whenever there is a stress in the body, it's a very natural thing. We need more energy, and where we have the more energy, from where we get the more energy is from the glucose. So it's increases the gluconeogenesis process, the process which increase the production of glucose in the blood. Because I repeat, in the stress situation, our body needs more energy and glucose. The second thing is the proteolysis, that is breakdown of protein, lipolysis, that is breakdown of fats, increased sensitivity towards catecholamines such as epinephrine or norepinephrine, which causes vasoconstrictions that lead to high blood pressure. During stress, every one of us experience this thing that we have low blood pressure, our body is cold. So this is a compensatory mechanism of our body, that it causes vasoconstriction so that our blood pressure do not drop. So ultimately this vasoconstriction leads to high blood pressure. Next function of cortisol is it dampens the immune system, that is decreased production of inflammatory mediators, prostaglandins, and cytokines. Some of the receptors for the cortisol are present in the brain, which that's why it influences the mood and the memory as well. So this is the list of normal functions of cortisol. Now you can imagine in Cushing disease or Cushing syndrome, there is an increased level of cortisol. So what would be the effect of cortisol in the body if it is present in the plenty amount in our blood? So it's understood its function may multiply 3 times. So everything goes up. As you can see in the diagram, the symptoms of Cushing syndrome are emotional disturbance, moon phases, osteoporosis, cardiac hypertrophy due to hypertension, because we know it causes vasoconstriction by increased production of epinephrine and norepinephrine. Buffalo hump, this is due to as I mentioned about the normal function, that it causes lipolysis, which is breakdown of fats. But why we are having this buffalo hump and obesity? The answer is because, yes, it's break down the fatty acids or lipids, but it causes a redistribution of these fats in the body, which deposit in the back and in the lower part of the tummy. Thin wrinkled skin, this is due to the increased level of cortisol. Amenorrhea, because when there is increased level of cortisol, it disturbs testosterone and estrogen level, and the sex hormone level is also dysregulated due to increased level of cortisol. That's why the person may experience amenorrhea. Muscular weakness due to proteinolysis, purpura and skin ulcers, poor wound healing. Because it suppresses the immune system, that's why the patient may experience poor wound healing. So these are some of the symptoms of the Cushing syndrome. The common question is the Cushing disease versus Cushing syndrome, how we can differentiate that. Many people confuse this thing. Basically, in both conditions, either it is Cushing syndrome or Cushing disease, there is increased level of cortisol in the blood, but the difference is in the ACTH level. In Cushing disease, whenever there is increased level of cortisol in the blood due to ACTH, that is due to increased production of ACTH, that means it is Cushing disease. And the most common, we have this SPA, that what is the most common cause of pituitary Cushing disease, which is pituitary adenoma. In pituitary adenoma, as we've seen in hypothalamus pituitary axis, the ACTH is produced by the anterior pituitary gland. If there is any adenoma in the pituitary gland, that causes increased production of ACTH, and this increased ACTH affects on adrenal gland and produce more and more cortisol, and as a result, patient may have Cushing disease and Cushing's symptoms. And mostly in Cushing disease, the cause of the increased cortisol level is endogenous. That is, it is produced within the body. On the other hand, if we see the Cushing syndrome, it is ACTH independent. That is, it is solely characterized by increase in the level of cortisol. While in the Cushing disease, it is characterized by increased level of ACTH in the blood. Causes of the Cushing syndrome is the adrenal adenoma. That means the ACTH production is totally fine. There is no excess of ACTH in the blood, but still cortisol is increased in the amount in the blood. That is maybe due to adrenal adenoma. That is, there is any tumor in the adrenal gland which is producing cortisol in excess amount. It may be bilateral adrenal hypertrophy. It could be adrenal carcinoma, or it could be exogenous, that is steroid treatment. For example, if a child is having any treatment for asthma and he's on the steroids, he may experience this Cushing syndrome. He may have these Cushing-like symptoms, as I mentioned previously. So this is classic Cushing syndrome. Investigations. The first line investigation is 24-hour urinary cortisol, and we have this SBA. If you do not find a 24-hour urinary cortisol in the option, you can go for dexamethasone suppression test. Plasma ACTH level to differentiate between Cushing disease and Cushing syndrome. Then we have MRI CT scan of pituitary or adrenal gland. Treatment depends on the underlying cause. Exogenous medication, if the cause is exogenous medication, like if a patient is taking steroids for any autoimmune disorder, or sometimes athletes may consume steroids, so in that case we have to taper off the dose to avoid withdrawal symptoms. If the underlying cause is pituitary adenoma, then surgical excision is the only option. Any questions? If you want to ask any question from the microbiology, you can ask me. Now coming back to micro, I wanted to tell you how you can tackle the theory of the microbiology. So in the high yield topics, I mentioned about the structure and classification of bacteria. So try to focus on those bacteria which are relevant to obs and gynae. They usually ask questions from the UTI. There's no need to study very deeply about the structure of bacteria. You should know just very basic information. In bacteria, the important bacteria are group B, group B Streptococcus, E. coli, Staphylococcus, gonorrhea, Gardnerella vaginalis, which causes bacterial vaginosis, syphilis, chlamydia, and you have to cover pelvic inflammatory diseases. And it's a good thing if you study the management and the guidelines along with the microbiology. In that way, you would remember. And one thing, when you are going to study viruses, you need to study the basic structure of the virus, and yes, the classification. The viruses are way easier than the bacteria. Bacteria's classification are very lengthy, while the viruses ones are short. You should only need to remember the RNA viruses and the DNA viruses. You just remember the names of the viruses which are DNA, and the list of the viruses which are RNA. The most important viral diseases in the RCOG curriculum are the hepatitis B serology. We have many questions from that. What happens in the exam? They will give you a report, and you have to interpret the stage of the viral infection. That they may ask, is it in the incubatory phase, the virus, is it treated patient or not? So they have many questions from the Hep B serology. You should know about the Hep C serology and the HIV. In the HIV, you need to remember the guidelines. If the patient is pregnant, what kind of treatment or what kind of protections you are going to provide to the patient, and during childbirth and after childbirth, what kind of protocols a mother need and what kind of treatment the child need. And the torch infections. You have to cover all the torch infections, in which rubella, there are many questions from the rubella, from the cytomegaloviruses. So torch infection is also important. Then we are left with STIs. When you are when you are studying bacterial classification, you would cover the STIs. So this is a very short topic, and you may have 4 to 5 SBAs from this section. So that's easy subject for the exam. Bhanu Teja, yes, I read your message in the WhatsApp group, but there was a shortage of time, so that's why I just focused on Cushing disease and syndrome. But yes, definitely, I'm going to address these topics in the next webinar. Addison disease is very easy. It's just opposite to the Cushing's disease or syndrome. As in Cushing disease, there is increased level of cortisol, while in Addison disease, there is decreased level of cortisol. So the effects are opposite. We can compare easily. In Cushing disease, if there is hyperglycemia, in Addison disease, there would be hypoglycemia. Likewise, if in Cushing disease, there is hypertension, while in Addison disease, there is hypotension. So it is opposite. That's easy topic. I would address this topic in the next session. Don't worry. Any other question?
I think that's all, Dr. Sumbal. Thank you for the wonderful session.
Okay, welcome. Okay, goodbye, everyone. If you have any question or any query, you can drop a text in the WhatsApp group, and I will address these topics in the next session you are asking about. Thank you so much for joining us today. Take care.
Thank you
Bye.
so much, ma'am. Bye-bye.